So this patient has a migraine, and so what we're doing is looking at some points on his ear that may help with his migraine. So far we've done a little bit of help. He's gone from a 7 out of 10 on his pain scale to about a 5 out of 10. So we're working to try to get that down a little bit more because we want him to feel better. But we started out a little bit, just kind of we started out with some needles here in his foot and one in his leg. And these are just areas that help him feel better overall throughout his whole body. And then the ears, we're going directly after the head pain. Garrett, did it hurt when they went in?
Just on the legs and stuff. No, but a little pain when they come in the ear though.
Yeah, the ears tend to be a little bit more painful, but the ones on the arms and the legs tend to not be tender.
Do you use the darts also?
I use the darts. I don't have any with me, unfortunately. So, but usually we'll use the ear darts and leave them in the ears for a little while if we decide which ones work. I have little beads that you can tape to the areas that you can rub through until we come back tomorrow and maybe with some darts, if that's all right with you guys. So acupuncture is one of those things that's not very well understood in the West. We don't really quite understand it here, but it's been done for thousands and thousands of years in the East, in China and Japan. So what it does basically is opens up your channels through which your qi flows, and qi is considered in Eastern medicine to be your life-giving energy. And so the thought process is your body as a whole, and you don't just have a headache because something's going on with your head. It can be lots of different things. Your hormones can play a role, your electrolytes, all kinds of things can play a role, your stress, tension. And so what we try to do with acupuncture is to improve the overall body and the flow of energy through the body and the health of the body so that your body can heal itself. And there's just different techniques to do that.
The first time I tried this, I thought it was crazy that that it actually different spots helps.
Me too. That's what I thought too.
And it does help a lot. Somehow it helps a lot, and I think that's helping my head get. The needles don't really hurt at all. Just relax, and they won't hurt at all. But if you're worried about them, they're gonna start hurting a little.
That's true. I actually stuck a couple needles in my 15-month-old niece, and she, besides me holding her arm, she had no idea I was doing it. So that was kind of my test to see really how infants and babies would be able to handle it, and she just was annoyed that I was holding her arm rather than sticking needles in it. So didn't bother her at all.
Wow.
There you go. And this is the area the area on the ear. There's some representative spots on the ear that correspond with the rest of the body, kind of like a miniature homunculus, which you probably won't want to put on the website. But it's so fascinating though. He's such a good patient. So right now what I do is I just touch the areas with the back of the needle, and if he feels a tender or a ticklish spot, then he tells me, and I put the needle in that. And that's how I know where to go.
Dr. Harden said thanks for taking care of Garrett.
Oh, good.
That was her calling.
Oh, okay.
I had put a call into her the other day.
I don't think there's anything.
Anything else? Okay. Okay.
Dr. Harden said hello, and she said you're in good hands.
Okay.
Yeah.
It's not the needle that actually hurts, it's the plastic thing that they push down to put the needle in.
Hello up here.
Yeah.
That's actually a anxiety spot. And he doesn't seem to be one with anxiety, but when you have a lot of pain, sometimes that can kind of manifest. Is that how you can tell with his migraines that his cheeks are red? How is that? All right.